Hi, my name is Darby Judd, and I completed my preceptorship at Tacoma General in the Labor and Delivery Department. My capstone title is Nursing Care for a Woman Experiencing Induction of Labor. And I chose this topic because so many of the patients I worked with were undergoing some sort of induction, whether that was mechanical or chemical. And I wanted to know more about the different induction methods and what the nurse's role was in induction, as in my experience, a lot of the decisions within induction were up to the nurse's discretion and their assessment. So it really drew my questioning to this topic. As I explored the literature, there were three things that stuck out to me. The first thing that surprised me was the increase in inductions across the years. In 1990, 9.5% of women were experiencing induction. And in 2018, 27% of women in the labor process and underwent some sort of induction, which is a huge expansion from 1990 to 2018. One thing that was reinforced to me through the primary research was that if a induction is medically indicated, it's that you see better outcomes with induction than you do with waiting for spontaneous labor. There are decreased NICU admissions and overall better maternal and fetal well-being with induction instead of waiting for spontaneous labor. And something that I saw in practice, and then that was reinforced in the primary research that I found, was all of the different interventions that a nurse can do during induction or during labor in general, whether that includes fluid boluses, position changes, or oxygen administration. The primary research showed that all of these are positive interventions if you see something in your assessments. Something that I would want a reader to walk away with is this overall picture of safety, the importance of safety in induction, and what safety measures are taken by the nurse and healthcare providers to create a safe induction. Because during induction, there are sometimes more necessary interventions than in spontaneous labor. So that was really evident to me through my primary research, and I wanted to share that with the reader. Another thing that I want somebody to walk away with from my poster is the overall understanding of what induction is and how that works. Like, there's a lot of fear and stigma around the concept of induction, especially for the laboring woman. Many often said to me, I don't want to do this. I'd rather just try for spontaneous labor. But if we're able to educate our patients and our healthcare providers, all that stigma can be changed. And there's still a lot to be known about induction, but my poster shows the basics of how to create a safe induction by assessment, knowing what those assessments mean through electronic fetal monitoring and more, and then what interventions need to take place to have a healthy baby. So one of the questions that was brought up to me about my poster is, when is an induction actually medically indicated? So I do speak about that in my initial assessment, and a induction is medically indicated for all sorts of reasons, but most often for pregnancy-induced hypertension, premature rupture of membranes, and early labor. And in early labor, you might see decelerations of the heart rate, and that would be a sign that something needs to change without doing spontaneous labor. So overall, I loved researching induction of labor, and I hope everybody who reads my poster walks away with a better understanding of what induction is. I want to thank all of my professors at PLU for helping me get through this, and of course my preceptor at Tacoma General, Debbie Mankama, for helping me make this happen. Thank you.